Hesse. I am the Managing Director of Marketing and Communications here at AIHA. I am just going to share a few little details, housekeeping, and then introduce our presenters. So during the town hall today, the Q&A feature is available for you to know any questions you may have for the presenters. The chat feature is not accessible to our attendees. The meeting is being recorded, so it's possible for others who couldn't attend today to watch it afterwards, which we will be making available on our website following next week. Now I'm going to introduce our two presenters. My pleasure, of course, is to introduce Larry Sloan. Many of you already know Larry, if not all of you. Of course, he is the CEO of AIHA, and he has been in this leadership role since October of 2016. Prior to that, he had served as CEO for 7 years at SOCMA, which is a trade association representing the interests of U.S. specialty chemical industry. Our other presenter is Ken Martinez, who is the Chief Science Officer of Integrated Bioscience and Built Environment Consortium, also known as IBEC. Ken is an environmental engineer and a CIH with experience in leading and conducting large-scale research and managing programs in occupational health, safety, and emergency response. He was with CDC for 33 years as hazardous agent exposure characterization and mitigation control practices. It is my pleasure to introduce them and turn the meeting over to them. Larry?
Okay, thank you, Sue. Welcome, Ken. It's an honor to be here. So first slide up. Let me start out by just saying that the partnership between AIHA and IBEC came about when we were awarded the partnership grant from the CDC back in February of last year. And that was really thanks to our friends at NIOSH for all the work that we did with the Back to Work Safely campaign. The genesis of this grant was based on that work in Back to Work Safely, starting back in April of 2020. And throughout the summer of that year, we released over 24 Back to Work Safely guidance documents that featured very common sense practices on how to safely reopen businesses with a focus on small businesses that lacked OEHS expertise and knowledge. So these guidance documents were really designed to speak to the end user who did not have the in-house resources to address the pandemic. And when we got the grant, we had been familiar with IBEC as a result of their series of clean summits that began in 2020. And we found an excellent partner with deep subject matter expertise in the control strategies to help protect people, which is our most important asset, from the hazards of airborne transmissible viruses such as SARS-CoV-2. And we've been working with IBEC now for over a year, and we could not be happier with our collaboration. Next slide, please. So our grant award is based on 4 distinct and different projects. The nomenclature of these projects really was based on our original application. And we just decided to keep the nomenclature for convenience purposes. So Project A, first one on the slide on the left, was something that was actually underway when we received the grant. And that was the revision of the 2006 publication, The Role of the IH in a Pandemic, which through the leadership of a very committed group of volunteers was updated and released last fall. This document now numbers, I believe, close to 100 pages. It's much more comprehensive in scope, and it really extends the guidance beyond specifically COVID. It's really more about pandemics and infectious disease incidences in the future. Project B is a series of video snippets which helps companies first assess their risk profile through a series of questions. And Ken's going to get into this a little more shortly. And then depending upon their risk profile, if they're lower risk profile, they're directed to a set of videos on face coverings or face masks. If they're higher risk, then they're being directed to a series of videos on PPE. Project C is a series of video snippets and other knowledge products that are really rooted in our back to work safely guidance. And I'll get into that on the next slide. And then finally, Project B was a C.L.E.A.N Summit webcast that we aired back at the end of January. And this webcast featured multiple panels of experts that discussed the needs and solutions to address the pandemic. So next slide, please. So this slide shows the target audiences for each project. So you can see for Project A, we updated the publication, and then we created collateral or supplemental assets that are aimed at 3 specific market segments: healthcare facilities, long-term care facilities, and general small business facilities. And the purpose of these knowledge products is to explain to these different audiences, what's the value, what's the role of the OEHS professional, and then ultimately, how do I get in touch with one? So this routes people to our online consultants listing. Project F is again designed for 2 specific broad industry sectors: healthcare and long-term care, and then small businesses and the general public. Now, one thing to keep in mind is that when one goes through the risk analysis, just because you are in a healthcare facility does not necessarily mean that everybody is necessarily in a high-risk environment. You could have somebody who's working, say, in the accounting department or isolated in a warehouse somewhere, who does not come in contact with folks that are considered high risk or that have COVID-19. So you really want to identify and analyze the risk profile for different populations of workers within your facility. It's not a one-size-fits-all for a specific facility. Project C, the Back to Work Safely derivatives, what we did is there are 27 Back to Work Safely documents that we've been updating over the last couple of years. And what we did with those materials is we decided to create 3 primary knowledge products. One is the bucketed for the service industry sectors. So for example, gyms, hair and nail salons, dry cleaners, all of that falls into the service industry sector. The next bucket is the manufacturing sector, which includes manufacturing and warehousing. And then finally, the last bucket is the office-based industry sector. And that would be obviously things like general office buildings and the like. And so the guidance is derived along those 3 lines, and the knowledge products are laid out accordingly. And then finally, Project B, which was the Needs Assessment Summit that was aired at the end of January, we ended up having a series of panels. The first was on first responders. The second was on various educational facilities, ranging from daycare to institutes of higher education. The third was on the gig economy. And then the fourth was on vulnerable workers in agriculture and construction segments. And each of these panels featured experts that basically were providing, an update on what are the practical solutions that were deployed during the early days of the pandemic, what worked, what didn't work, and what are the steps forward. So it was really a very practical, hands-on series of panels. All right, next slide, please. So these free knowledge products were really the drivers for the Commit to C.A.R.E initiative, which is what we're going to get into now. And this is a very simplistic approach that's, again, tailored to the general public. One of the key differentiating factors on all the deliverables that have been produced under this grant is that together they're suitable and they're valuable for all audiences, regardless of how much knowledge or expertise they've got in the IH or OEHS profession. Now, some of the products developed, such as the COVID-19 exposure assessment tool and the role of the IH in a pandemic guidance document, those 2 products are geared more towards the knowledgeable audience, the IH professional. So on the slide, the left-hand icon and then the icon in the center bottom, which is a little bit of an eye chart, that's the online exposure assessment tool. They are not posted to Commit to C.A.R.E. They are on the AIHA website. Well, we'll get into that in a little bit. But all the other products, the videos, checklists, the other interactive web-based tools, they're all available on Commit to C.A.R.E. and they're all tailored toward small business owners, larger organizations, and workers across all industries. The webcast that we broadcast in January, that Needs Assessment Summit has allowed us to share contents of Commit to C.A.R.E. with a much broader and diverse audience across many of the industries that were included in this grant project. Next slide, please. And so the dissemination now of all of these deliverables that have been produced is going to span a period of 12 months. So basically all of this year. And we're very proud that we've already solicited the endorsement of a variety of professional partner organizations. There's a slide later on that shows the various icons, but I'll tell you now they include organizations like Workplace Health Without Borders, the National Safety Council, APSA, and the Australian Institute for Occupational Hygiene. So we're very pleased and honored to have garnered their support and endorsement. The goals of our communications plan are basically to debunk the myths that surround the pandemic, set the science straight and really explain it in very simplistic terms, provide a variety of tools for businesses and employees that can't afford to hire an IH professional, and then produce additional trainings that go beyond COVID. We want to make sure that the materials are more evergreen and that they're more reflective of general pandemics, not specific to COVID. And how do we do this? We're reaching out to you, the members, to leverage your networks. We're going out to influencers that can help us spread the word, and also through earned and paid media opportunities. So it's a multi-pronged approach to promote this website and the various knowledge products that are contained within it. And with that, I'm going to turn it over to Ken to continue the next set of slides. Thank you very much.
Thank you, Larry. It's a pleasure to be here today. So as part of the CDC grant, one of our tasks was to disseminate the knowledge products, the information that both the AIHA and IBEC created together. And that's not an easy thing to do. So the NAS or the Needs Assessment Summit was a way for us to understand these very specific audiences and how to reach out to them. But then the brainstorm happened and the pledge was born. The Commit to C.A.R.E pledge, and C.A.R.E standing for commit, awareness, responsibility, and equity. This was our way to level the playing field with regard to understanding about COVID-19 specifically. So by what I'm saying as far as level the playing field, if we address the issues, the risk factors on a very high level, right, that is digestible, but by not just the technically competent, but by, when I mean technical, I mean the science, folks like us, industrial hygienists and medical officers as well, but by everyone, the public, employers, employees. If we level the playing field, we increase the communication that can occur across all of these different folks interacting in the built space. So that if an employee walks into their restaurant, for example, a server, and sees that the employer has placed a portable air cleaner in there, they can say, ah, I understand what's happening here. So when I talk about simplification, this slide describes what we call the 4 Ds. These are the risk, both factors and risk mitigation strategies. The content that was created was developed out of CDC guidance. It was developed out of the American Industrial Hygiene Association guidance, both the Back to Work Safely and the IH in a pandemic. And also my experience with CDC over 33 years in dealing with responses to infectious diseases. So when I first wrote up the content, it was a 9-page document. I'm a scientist. I thought, this is great stuff. My marketing team laughed at me and said, Ken, we can't send this out there. So we all got together and we boiled it down to what we call the 4 Ds: dilution, density, distance, and duration. Now, as occupational and environmental safety and health professionals, you understand all these concepts. Next slide, please. So let's break this down a little bit. If we talk about the risk factors, right? Just as you evaluate a chemical exposure in some business, some manufacturing opportunity, right? You have a certain exposure there, right? And it's about that density, that concentration. Well, the same thing applies for COVID-19. So if you have a group of people, 2, 3, 10 people in a meeting room that are all gathered around, you don't know who's been vaccinated, who has not. You hope that most everybody has been vaccinated, but we know in this country alone that we're only at plateauing at about 65% complete vaccination rate. So there's 35% of the population that is not vaccinated. You don't know if somebody is sick and is just asymptomatic, even if they're wearing a mask, which it's even harder to tell now because CDC guidance says if you're healthy and you're vaccinated, you no longer need to wear a mask. So how do you know if someone is carrying COVID-19? You don't. So you base your decision on how many people are in a room, right? So that's that concentration, because if 1, 2, 3 people are actively sick and spewing viral laden particles, that concentration increases. So let's go to duration. How long are you in that room? Just as if you were over a furniture stripping tank. The longer you stay hovered over that, even if you have engineering controls in place, the longer or the greater your risk of inhaling whatever chemical that is, methylethyl ketone, for example, and then the higher your risk of being impacted by that. Let's go to risk mitigation factors. Again, very simple, you've heard this. I'll address the first one, which is distance. The farther you are away, these airborne viral-laden particles, while concentrated near the person who's infected, as it begins to diffuse through a room, they spread out. That concentration effectively gets less dense and hopefully will get below that infectious dose. So distance is a factor. The farther you are away, the less the concentration is. However, having said that, we know from the published literature that there are many super spreader events that a person in a room 30 feet away on the opposite side of the room can still be exposed, infected, and contract COVID-19. So we're not saying distance is the cure-all, but it is a factor to help reduce the risk. The other one is a simple one, dilution, right? If we can get that concentration of viral-laden particles below an infectious dose, then we're less likely to become infected. How do we do that? Well, improve the ventilation. That can happen through increasing the amount of outdoor air. That can happen through increasing the filtration efficiency. But we also need to consider with dilution the pathways of airs that move in a building. For example, if we're talking about long-term care facilities, we want that patient room to be under positive pressure with cleaner air, because we want to ensure that whoever's in the hallway that could be sick does not generate an aerosol that can then be transferred into that patient room. So we need to think about pressure relationships and air movements in a building as well. Next slide, please. So Larry did go through this already. So it's community, awareness, responsibility, and equity again. It's very simple. It's a grassroots effort, and there is no charge to participate in this effort. And IBEC is so proud and happy to be a partner with AIHA and pushing this out there. And as Larry said, we have a lot of partners that are committed to work with us and move this forward. And it's growing every week. Again, it's about debunking the myths about the spread of COVID-19 virus, make the complexities of the science easier. And you'll see this through some of the videos that we've created. We've taken this very scientifically based content and evolved it into 2 or 3 minute videos that communicate the key issues. And we want to encourage businesses to pledge their commitment to care. Again, no cost. We just want them to commit to it and show their employers, their customers, their clients that they are aware of these issues and are doing their best to address them. Next slide, please. So this is the Commit to Care pledge. Next slide. So what is it about? This is our sequential lessons to help any organization. Now, you as industrial hygienists should appreciate this, because it's about determining relative risk. What are industrial hygienists but risk assessors? We anticipate, we identify, we evaluate and control, and then we take the cycle around again. We are the ultimate risk assessment profession. But not everybody understands how to do risk assessment. So we are communicating on a very simple level about risk. And so if you take the first video, you'll actually find a link to a very simplified risk assessment tool to give people who are going through that video an understanding of what a risk assessment is. And it's based on the C.L.E.A.N model that is actually addressed in the AIHA and the pandemic. It's basically a hazard banding, control banding concept focused on infectious diseases. So it's a very simple in terms of that. You're either in a high risk or a low risk. If you're a low risk, maybe you just wear a mask. But if you're in a high risk, such as a healthcare worker who's actually seeing patients, then you would wear an N95. And as Larry said earlier, not everybody in the healthcare industry is going to be in a high risk category. The videos also target workforce training, right? How do you train them about masks, respirators, ventilation, which is the next issue, which is the big one with dilution, how to assess and improve building ventilation. But critically important, who is best suited to support healthcare, businesses, restaurants, the occupational environmental health and safety professional? As I said before, we are risk assessors. We can go in there, and even if we don't have a background with infectious diseases, you still understand the concept of an exposure to a biological agent, how to address that, and how to mitigate that exposure. So we have videos that address how to determine whether a business needs an IH, and then how to understand how to find industrial hygienists. But everything that we focused on, or most predominantly what we focused on in the Commit to CARE, are environmental mitigation strategies, right? But we have not ignored vaccination or human diagnostic testing. These are critical components to controlling the pandemic. But the broader scientific community agrees that this primary mode of transmission is airborne. So environmental mitigation strategies, such as improved ventilation, must be complementary to our efforts. Next slide, please. So where are we targeting? Who is our audience? Again, employers, employees, and the general public. As we begin to grow the Commit to CARE program, we'll start working on targeted industry sectors. For example, as we did in the Needs Assessment Summit, perhaps the first responder community. We're going to reach out to them to provide the videos from that summit, but also use that as a leverage point to get them to partner, to share in the Commit to CARE program. Or it could be the education industry sector. So we will target those moving forward into the future. Next slide, please. So we're going to quickly walk through these. All right. So the reason being is we want you, even as an industrial hygienist, please go through and track one of these. If you're an employer, if you're an employee, commit and go through the trainings. The videos are only 2 to 3 minutes long. The interactive risk assessment tool will take you about a minute. So it's not a long process, an hour of training that you'll have to devote to, but we want to hear your feedback as experts in the occupational safety and health community. So the first one is about determining your risk, and I talked about that earlier. Next slide. I spoke about all of the workforce training that we have. They include both videos and printed content, but again, we talk about risk assessment. How does that drive to determining high or low risk? What are respirators? How do you don and doff them? What is ventilation? What are masks? Why do they work? Next slide, please. Ventilation is critically important. We have a video devoted to that. But we also provided checklists, both for HVAC optimization and personal HEPA air filter checklists. Now, these are very high level. So as you go through it, I know you're going to say, well, that doesn't say this, or, it's not detailed enough to address this. No, this was targeted to be across a broad audience, to give them the understanding they need to go and ask the appropriate technical person, such as an industrial hygienist, for more detailed focus. Next slide, please. We also have printed materials that they can post. If someone actually goes through and takes the Commit to CARE challenge, a restaurant owner, for example, they can post up their proper mask fit poster, or remembering the 4Ds or ventilation tip posters. Next slide, please. And also wearing masks can be educational to their customer base as well. So you can post this closer to the door. We do still see businesses who require mask wearing. I just dropped off a package at FedEx 2 days ago. Even in the presence of CDC's current guidance, the door still says anybody who enters must wear a mask. Next slide, please. I already talked about the determining if you need an IH and how to find an occupational health and environmental safety professional. We have videos to address that, and we also have a link to the online AIHA's consultants directory. Next slide, please. And as I mentioned before, we did not ignore vaccination nor human diagnostic testing. Next slide, please. So is this me now, Larry, or is this you?
This is your last one.
Okay, thank you. So as you take the test, you will receive a digital badge. If you're a business, if you're a partner, if you are a graduate of the training itself, that you can post on your doors. Use it as a logo when you send out your emails to show that you believe in the program and that you support the ideals that we're presenting here today. Next slide, please. And to you, Larry.
All right, very good. Thank you, Ken. So as we wrap up here, there's 3 levels of endorsement and support that we're reaching out to our allied associations and other corporate partners. Level 1 is basically an endorsement level. We provide you, providing us with one's organization's logo. We would add that logo to the Commit to C.A.R.E website and provide you with communications materials. Number 2 is Endorse and Share, which is a combination of number 1 and your organization's commitment to share information about this program with your colleagues, with your constituents, with your membership. If you agree, then we would provide you with a media toolkit that would contain sample newsletter articles, sample email invitations that could be tailored to your members, sample social media posts, and also artwork for you to add to your own webpage. And then finally, level 3 is the Endorse, Share, and Lead. And that would be a combination of number 2, plus your organization's commitment to appoint a liaison that would help us reach out to other audiences. So this would be somebody who could help arrange brief webinars, either within your organization or outside of your organization, to further educate and mobilize even more people to make them aware of the Commit to C.A.R.E website. This particular appointee would also be invited to periodic meetings and be provided with a leadership toolkit that would help guide them in joining us as we lead this public education effort. So level 1, endorsement; level 2, endorsement and share; level 3, endorsement, share, and lead. Next slide, please. So here is an up-to-date listing of the various organizations and agencies that have stepped up thus far. We've just begun our outreach. We've done various presentations. We're very pleased to report that just yesterday we heard from APSA and also the Australian Occupational Hygiene Association. So we'll be adding their logos to this slide. We've also reached out to over 200 other allied professionals, including the Better Business Bureau, National Chambers of Commerce, and the Small Business Administration. So this is really a very broad grassroots effort to spread the word. So we're going to continue to reach out, even to those that said they couldn't participate right now due to other more pressing priorities. We are going to continue to stay in contact with these organizations because we feel that this is a very, very worthwhile initiative. And again, as Ken noted, all of the information, all of the materials on the website are completely free of charge. Next slide, please. So our call to action for AIHA members would be to share this PowerPoint with your employers. And if you're a consultant, if you are dealing with other companies, we encourage you to share this PowerPoint with your clients. Take the pledge yourself. As Ken indicated, these videos are relatively short and you can really whiz through a lot of the materials in a very quick amount of time. Share Commit to C.A.R.E on your social networks. And then please don't hesitate to connect us with any organizations or companies that you think would be willing to step up and take the Commit to C.A.R.E pledge. And with that, next slide, please. I want to thank you, Ken, for co-presenting so well with me today, and thank everybody for their time and attention. We'll take questions in the Q&A section, and thank you very much again for your interest. Sue, I'll turn it back to you.
Thanks, Larry. Thank you, Ken. Would anyone have any questions? I haven't seen any questions come through at this point, but if you do, we'd ask that you would please pop them into the Q&A and we'll be happy to answer your question. So I think I'm going to actually seed a question here and ask both of you for your advice, and that is if an organization is willing to sign on to Commit to C.A.R.E, and they, for example, let's just say a big company or even a small business, and they sign on as an employer, what would be the next step for them as an employer to encourage their employees to get involved.
I'll kick this off. You know, one of the first things a company can do is to get with their human resources department and to integrate training opportunities, perhaps throughout their schedule, so that the employees actually have time to become familiar with the materials. You know, there's a lot of information there, but I think the company has the responsibility to communicate very clearly to its employees, we've signed on as a sponsor, we're taking this pledge, we're going to walk the talk, but then they need to make sure that they're very clear with their employees on what their expectations are. And that probably needs to be orchestrated through the human resources department. So that would be my suggestion as a next step.
Thanks, Larry.
And
Go ahead, Ken, please.
let me follow up with that. So we really like, you know, the point of contact to run through the training for us. I've actually approached a couple of larger companies, and one of the pushbacks I got was saying, well, we don't want this to substitute for the current training that we're doing that's very detailed. I said, no, that's not the point at all. If you have training that you're delivering with regard to the pandemic, that's wonderful news. I said, what we're trying to do is get people to understand these basic concepts. And maybe they could use this as an introduction to their broader content that they have available. It would only take them like 10 minutes for an employee to walk through one of the training slides and then say, oh, this is intriguing. And so now they can actually push their more detailed training at these employees. Understand that this is a volunteer effort. This is not a mandate. We want to be clear about that. However, if you were to look very carefully at all the content that we generated, it is very similar with almost 100%, not quite 100%, but very similar to the OSHA emergency temporary standard that was out there, where the ETS talked about a job hazard analysis. What is that if not risk assessment? They talk about ventilation. They talk about masks and respirators. We were addressing the same things. We're just giving a very simplified, high-level view of all of the key things that need to be in everyone's mind with regard to these things. And if people want to delve deeper, there are other options to do that as well. Within a company, within a corporation, or even outside that. For example, we do know that the Laborers International Union of North America has an extensive training program on COVID-19. Back to you, Sue.
Awesome, thank you so much. I also would like to mention that if, as an AIHA member, anyone would like to possibly do a presentation about this or add slides like this to a presentation you may have coming up, we will make these slides available to members, and we will be putting that on our online community, The Catalyst, and making that available for you. At this time, I don't see any questions, but I don't know if people are having trouble finding the Q&A box here, but I do hope that if you have any burning questions, you see our email addresses here on the screen. Please do feel free to reach out to us. And we are very grateful for your time and your interest in this wonderful public awareness initiative that we are very proud of. And as IHs, hopefully this will help raise not just the awareness for this initiative, but also awareness of the profession.
And I think I'd add to that and just say that, you know, we've presented a lot of information for folks that are not familiar with the site. And I would encourage folks that have watched this recording to take a look around at the site, poke around, look at it from the perspective of the employer, the employee, and the general public. There's, again, 3 different pathways, if you will, depending upon where you're coming from. And several of you obviously can wear multiple hats. You might be the employer, you might be the owner of your organization, you might be an employee, and you're certainly a member of the public. And take a look at the different pathways, and you can see the way it's organized is by pathway, employer, employee, general public, as well as then by industry sector. And for those of you that are consultants, you might want to take a couple different approaches, depending upon the kind of work that you do, whether it's in the healthcare sector or not. And you'll see there are different nuances to the different educational knowledge products that have been presented along those different pathways of learning. Thank you, Sue.
And one final message from me is that there's been a lot of attention over the past couple of weeks that we are in a decline with COVID-19, that things are improving. We're out of the woods. I've seen that published in the literature in places. CDC has rescinded their guidance with regard to mask wearing indoors for those that are healthy and vaccinated. I personally think it's too soon. As I mentioned before, we still have 35% of our US population that goes unvaccinated. Omicron BA2 is on the decline, but we are seeing some rumblings from other countries where BA2 is beginning to take a foothold. And from what I've seen in the literature, it is 30% more transmissible and can be more severe. And it is creating a problem in a few countries, such as Denmark, that completely rescinded all of their mandates. So, as industrial hygienists, I encourage you to be prepared. Keep your eyes on the horizon. And while we may not be done with this yet, in my opinion, this will not be our last pandemic. Take these things that we've been through in the past 2 years and as lessons learned, and apply them moving forward to your business, to your consulting firm, and helping our nation, helping your community prepare for what may be coming down the pipe next.
With that, thank you so much, Larry and Ken, for your incredible insights. And thank you all for your attention today. Have a great rest of the day.